What would you do if you needed healthcare but there was no hospital or clinic nearby? Geography is too often a barrier for rural citizens. Around 11% of Missouri's population lives in a county with no hospital, and this lack of access to care contributes to poor health outcomes. Life expectancy is around 1.4 years lower in rural Missouri than it is in more urban parts of the state. And around 11% of people are living with multiple chronic health conditions. Implementing telehealth programs could help to overcome these barriers to access in rural Missouri and benefit both patients and providers alike. My name is Claire Cardwell. I'm a senior health science student at the University of Missouri, and I'm doing an internship with MRHA. In this five-part series, we'll be discussing various aspects of telehealth and its implementation in rural healthcare. First, we'll start with why telehealth is important for rural Missouri. Then we'll go to planning, preparing, providing, and payment. So let's get started with why telehealth is important for rural Missouri. In this video, we'll talk about 3 reasons why telehealth is critical for rural Missouri. So first, we'll talk about how it can help to overcome geographic barriers, and then how it can help with the expansion of specialty care, and how it can help increase revenue for providers. So let's start with talking about some of the ways that telehealth can help to overcome geographic barriers to healthcare. So telehealth can help patients avoid long travel distances to get to healthcare services. So healthcare is not always easily accessible for people living in rural Missouri. In fact, 45 of the 99 rural counties in Missouri don't even have a hospital. And in these counties, the average drive to get to a hospital is 31 minutes. And long travel distances aren't just inconvenient. They can pose real problems for rural patients who are elderly, who have mobility issues, or who don't have access to reliable transportation. And telehealth would allow these patients to go to appointments virtually and avoid traveling long distances to go to an actual facility in person. And telehealth would also allow providers to see more patients without travel distance as a barrier. They could serve patients with minor issues that could be treated at home more efficiently if those patients don't need to actually visit facilities in person. This would free up space in clinics for patients who do need to come in person, and in turn reduce waiting times for those patients. Telehealth also allows for easily accessible follow-up appointments where providers can check up on patient healing and progress. Some patients require more frequent checkups or follow-up appointments, such as those who have just had surgery or are living with chronic health conditions. So traveling to a healthcare facility can be especially problematic for these type of patients. And telehealth programs allow these patients to connect with providers that can perform these checkups remotely. And telehealth also helps to expand the pool of providers. So in rural Missouri, there are only 47 primary care physicians for every 100,000 people. Providers often seek out work in more urban areas where the pay is often higher and there are just more things to do in general. So when there are fewer providers available, patients might not have access to the care that they need, and they can face really long wait times for the providers that are available. So telehealth allows for providers to be hired from outside just the local area, which will attract more providers to work within rural healthcare. So having a wider variety of providers available can bring improvements to multiple areas of healthcare. And an area that's especially important for rural Missouri is the expansion of specialty care. So rural Missouri is facing a shortage of specialty care providers. The 2 leading causes of death in rural Missouri are heart disease and cancer. And the death rates for these are higher in rural areas of the state than they are in urban areas. So almost half of all deaths in rural Missouri are caused by heart disease or cancer. And these are just 2 of the many chronic conditions that require specialty care. And this can be hard to come by in rural Missouri when a large portion of specialists are located in more urban areas. So only 28 communities in rural Missouri actually have access to emergency specialty care, which is something that's really relevant for even the top 2 causes of death, which are heart disease and cancer. So there are some particular specialties that are in really high demand in rural Missouri. So first, there's cardiac. So from 2009 to 2019, males in rural Missouri were around 16% more likely to die from heart disease than those in urban Missouri. And for females, they were almost 20% more likely to die than those in urban Missouri. Another big one is cancer. In that same 10-year span, 19 of the 20 Missouri counties with the highest death rates from cancer were rural counties. And then another big one is mental health. So as of 2019, rural Missouri had a suicide rate of 18.4 per 100,000 people, and that's compared to the rate of 15.5 in urban areas of the state. And rural Missourians also reported having 14 or more poor mental health days, more than those in urban areas of the state did. And a contributor to the poorer mental health outcomes and the higher suicide rate in rural Missouri could simply be because they have less access to mental health resources. So how can telehealth actually help with these things? Well, telehealth programs will allow patients to consult with specialists outside just their local area, increasing access for those who need it. And if specialists are regularly available via telehealth appointments, patients can avoid long wait times and scheduling will be made easier. And specialists and providers in different locations can communicate with each other and share information on patient care plans, which can help patients receive faster and more consistent care. So now that we've discussed some of the ways that telehealth can benefit patients, let's talk about how it can actually benefit providers and the healthcare system and bring in more revenue. So one of the biggest things with telehealth is that it's really convenient. And this convenient appeals to a lot of people, and it helps to attract more patients. If patients could have a medical consultation virtually rather than driving a long distance to a doctor's office, they might switch to a provider that has telehealth implemented. And telehealth also increases the capacity for patients. So with more patients, providers can be able to bring in more revenue overall. So another thing is that telehealth opens up the opportunity to hire and train virtually. So the ability to hire providers virtually in telehealth allows for more providers to work within the rural healthcare system and serve more patients, which will in turn bring in more revenue. And there's also the opportunity to do some providers training partially virtually, which can save the healthcare system money that they would usually spend on in-person training and resources. And finally, telehealth can help to reduce no-shows and burnout, which can save the healthcare system money. So even the best hospital practices have a burnout rate of at least 12, or a no-show rate of at least 12%, and some have up to a 50% rate. And the total prevalence of burnout in healthcare institutions is over 40%. Burnout can cause providers to make more errors and to be less productive, which in turn makes the entire healthcare system less efficient and makes it more difficult to maximize revenue. And no-shows just cost the health system money because patients are not showing up for appointments and the health system is spending money on resources for those appointments that aren't being used and are just being wasted. But the no-show rates for telehealth appointments are exceptionally low because they're virtual. And telehealth appointments can reduce burnout by reducing the stress of documentation on providers, because a lot of these times these appointments are recorded, so providers don't have to actually write down things that they normally would during these appointments. And also, telehealth opens up the availability for other providers to fill in during difficult times like nights or weekends, and allows the providers that are working in person to take time off to maybe get a full night's rest or have a little more time away from work. And this can reduce the stress of working long hours and can help to reduce burnout. So in conclusion, there's a lot that rural Missouri can gain from implementing telehealth into its healthcare systems. It can help to knock down geographic barriers and give patients more access to healthcare. It can expand access to specialty care, which is an area that is very important, but unfortunately lacking in rural Missouri. And it can even help to bring in extra revenue to the healthcare system. Thank you for listening. Now that you know some of the major reasons why telehealth is important for rural Missouri, watch the next video in this series to learn how to start planning to implement a successful telehealth program.